Okay, so we start with the introduction first. For this data, it shows the daily COVID-19 cases in Malaysia among fully vaccinated individuals from November to December 2021. So, during this period, as we can see, the number of cases didn't stay the same. It kept going up and down day by day. The lowest number recorded was around 1,821 cases, while for the highest went up about 4,780 cases. This is mean that even though people were fully vaccinated, but the cases of COVID-19 still happen. But vaccination actually helped to reduce severe illness, but not completely stop the infection. Overall, towards the end of the year, the cases started to increase. So it shows that even after people got vaccination, we still need to be more careful and follow preventive measures.
The objective of this analysis is to examine the trend and distribution of COVID-19 cases among fully vaccinated individuals in Malaysia during the period from November to December 2021. In order to understand how number of cases change over time to time and to assess the continued occurrence of infection despite full vaccination.
The data shows the daily number of COVID-19 cases among fully vaccinated individuals in Malaysia from November to December 2021. Overall, the number of cases fluctuate from day to day, with a general declining trend toward the end of December compared to early November. This suggested that while breakthrough infection did occur, the situation became more controlled over time, possible due to improved immunity, public health measures, or reduced transmission. Even with the help of government controlling citizens' movement in all affected areas, the number shows uneven numbers of cases due to some irresponsible individuals who decide to treat the Malaysian Movement Control Order (MCO) as a chance to go back to their hometown and eventually leads to the spreading of the virus.
This graph shows the trend of daily cases fixed over time, from early November to the end of December 2021. The graph is a line graph with dates on the x-axis and number of cases on the y-axis. At the beginning of the period, the number of cases is relatively high, fluctuating around 3,000 to 4,500 cases. There are repeated rise and falls, showing a wave-like pattern rather than a steady increase or decrease. Around mid to late November, several peaks occur, reaching above 4,000 cases. From early December onwards, the overall trend shows a gradual decline, with cases dropping to around 2,000 to 3,000. The lowest point appears in mid-December, followed by a small increase towards the end of the period. Overall, despite short-term fluctuation, the graph indicates a general downward trend in cases over time.
To find the mean, first add all the values together. Next, count the total number of values, then divide the total by the number of values. To find the mode, list all the values, then count how many times each value appears. The value that appears most frequently is the mode. To find the median, arrange the values in ascending order. Next, find the middle value. If the number of values is even, take the average of the two middle values. To find the variance, first calculate the mean of the data, subtract the mean from each value, square each result, add all the square values together, and divide by the number of values. Standard deviation measure how spread out the data is from the mean and is calculated as the square root of the variance.
In conclusion, even though vaccinated people can still get COVID-19, the cases are usually less serious. Most vaccinated patients have milder symptoms and are less likely to be hospitalized. We also observed that increases in cases among vaccinated patients were often related to factors such as new variants and decreasing immunity over time, especially without the booster doses.
This shows that vaccines are still effective, especially in preventing severe disease, and booster doses are important to keep the protection strong.